Hello, everyone, and welcome to another edition of Pioneers of Healthy Lifestyle Longevity Series. This is webinar number 8, and today we're featuring a Soviet researcher, toxicologist, Dr. Nikolai Lazarev. He really was the one that rediscovered the properties of adaptogen herbs and how they can help the body combat different types of stress: chemical stress, physical stress, psychological stress. This information was sort of known and passed along over the years anecdotally by many different civilizations, but it was Lazarev who really started to do clinical studies to understand which herbs were effective in this regard. And so we sort of owe him a great debt of thanks. So for those, I have a number of people joining the live presentation today. We have a lot of people who registered for this webinar who will get the recorded version, but all of you will get these slides sent to you after the webinar so that you can drill down deeper, click on some of the links to read some of the research papers for yourself. I have to move at a fairly quick pace because there's just quite a volume of material to cover, actually. So without further ado, let's get started. So Dr. Nikolai Lazarev, 1948, was a Soviet toxicologist. He was the first one to coin the term adaptogens, talking about how the body can resist different types of stress and maintain more homeostasis. He was looking for natural tonics that the Soviet Union could use during the Cold War. That was the purpose of the studies. He was looking at all different chemicals, but a colleague of his named Israel Breckman said, you know, there are these plants that we've known about for a number of years from different civilizations that we know help the body deal with different types of stresses, such as Schisandra and ashwagandha and ginseng, rhodiola, some examples. He said, you should really be investigating these. So what these two doctors discovered as they started to do different trials was that what Ayurvedic practitioners had really known for many years, that certain plants had constituents that could help the body resist stress or deal with it more effectively. They started to see to apply certain proper studies to demonstrate true efficacy. So the Soviet government backed this because they were interested in giving their athletes an upper hand, their military an upper hand, and to use it in medical industries. So between the two of them, Lazarev and Breckman published 1,000 different clinical studies just on Siberian ginseng alone. But then their studies started to include other adaptogen herbs. And during the 70s and 80s, a lot of their Olympic athletes used these adaptogens. They looked at 4,000 different plants over a period of time, and they identified 12 plants had adaptogen properties, not only ginseng, but also Schisandra, rhodiola, and then later they looked at all the studies on ashwagandha. I will show you those. So there's all kinds of links here in further reading if you want to explore some of the history. I want to get into the science. What we understand, what Breckman and others were able to show us, is that these adaptogens or herbs have constituents that help us resist or sort of mitigate some of the impact of chemical stresses, biological stresses, even psychological stresses, and help us maintain better homeostasis and decrease the pathways towards pathology. And that's what's really important. Many of these adaptogen herb constituents are phenolic compounds and triterpenoids and sort of steroid-looking compounds. I've showed you on this slide what some of those look like if you want to explore that further. So along the way, they gave adaptogen herbs to Soviet cosmonauts during long stays on the space station, sailors on long trips, sailors in submarines, these explorers doing tropical expeditions and Arctic and Antarctic expeditions, pilots, sports persons. They've used these extensively to try to help these individuals withstand stressful circumstances to their body, to help maintain their mental performance, their physical performance, and decrease fatigue and succumbing to different diseases. Elders in the Communist Party for years have used adaptogen herbs. So adaptogen herbs have not really been widely accepted in the Western world, but a lot of the research that's coming up now in Western world psychiatric journals are showing, and I will show you these studies, the efficacy of adaptogen herbs in helping people prevent and manage mental health disorders. So I will show you those studies because that's now in the Western world of medicine. But just to review how stress impacts the body, of course, we have the general adaptation syndrome that was sort of brought to our attention by Hans Selye back in the day, showing that when we're under stress, the sympathetic nervous system is sort of upregulated, dominating the autonomic nervous system. And also the adrenal medulla is releasing more epinephrine and norepinephrine. So, you're going to get a heart rate that's faster, blood pressure goes up, all these things that are tied to the sympathetic system with these neurotransmitters. And also there's going to be an increased release of cortisol from the adrenal medulla because of the axis between the hypothalamus and the pituitary gland, which we will review in a moment. But as these things start to dominate and become chronic, it can trigger or exacerbate certain disease states and sort of have effects on the person's physical health and their mental well-being. So adaptogen herbs, to sort of conclude what we're going to see in the actual research, help to mitigate the effects by toning down these effects, helping to lower the secretion of cortisol secretion into the bloodstream, lowering the effects of cortisol, and also affecting cellular mechanisms right at a molecular level, which we will explore, that help to switch on green genes for survival, better energy production, antioxidant protection, improved neurotransmitter balance, protecting cells against dying prematurely, apoptosis, preventing them from going into senescence, preserving cellular function in a way that helps to support healthy physiology. So, of course, when stress is present, often there's sort of this alarm phase, and then the body has a heightened state of response to help guard against the effects of stress. And a lot of people think when they've got this heightened degree of fighting off stress that they're really adapting to it, but they're really not. This is really accommodating the stress, but you're borrowing from your body's deep energy reserves. And at a certain point, what often happens is a person, and you see this in clinical practice with patients all the time, eventually they reach a point of sort of there's no more reserves left, and they go into this state of exhaustion. And this is often what triggers the onset of a disease that they might be genetically predisposed to, or it exacerbates an existing condition you might have. An autoimmune condition is an example, canker sores, recurrent urinary tract infections, something that they're sort of prone to now surfaces or resurfaces. So in the beginning of stress, there's a heightened degree of adaptation. The person thinks they're actually dealing with the stress just fine. I can handle it. I'm doing great. No, I'm fine. But they're really just accommodating it, and they're borrowing from these deep energy reserves. And then at a certain point, you reach a state of exhaustion. And that's when it triggers the onset of disease, or it exacerbates a condition. This is often when cancer can manifest, or they trigger dementia, type 2 diabetes, all these things, and mental health disorders can also be triggered here. So adaptogen herbs help to attenuate this response to keep the body more in line with homeostasis and prevent that exhaustion from occurring that often triggers disease or triggers the reactivation of a health condition that they've had in the past. So in medical news today in 2017, they make the point that although Selye's original research was applied to physical stresses, in today's world, it applies also to psychological stresses, that your relationship breakdowns, relationship struggles, losing a job stress, medical problems, money problems, all put us into the general adaptation syndrome, which can lead to that point of exhaustion and lead to disease and actually exacerbate an existing condition. People back in the Stone Age, when they dealt with stress, having a heightened degree of resistance to stress was a great thing. Turning on the sympathetic nervous system, more cortisol release for a short period of time is very helpful. But they could then, get away from the stress and get back to something that was more normalized. In today's society, stress tends to be chronic. So eventually you reach that point of exhaustion and you go into a state where you're triggering a health condition or exacerbating it. So what we see is that long-term stress can affect the body physically and also the immune system, leading to a greater risk of viral infection, type 2 diabetes, stomach ulcers, depression, and even heart disease. So you see the references there. We're seeing that stress, of course, has an impact on these things. And I know that you already know this, but it's good to see the scientific substantiation. So to review what's happening with the hypothalamus and the pituitary gland, when stress is perceived by the brain says, oh, I'm really feeling stressed out. Then you get a release of corticotropin that goes to the pituitary gland. The anterior pituitary secretes ACTH, and that causes a heightened release of cortisol from the adrenal cortex. At the same time, in the sympathetic nervous system, you're upregulating not only the sympathetic nervous system, but remember that the sympathetic nervous system also stimulates the juxtaglomerular cells in the kidneys to release renin, which converts angiotensin 1 to angiotensin 2, and you also get more vasoconstriction, resorption of sodium, raising blood pressure, leads to all these cardiovascular types of things. So when stress is sort of chronic and the sympathetic nervous system is just over-dominating, then you often get increased heart rate, increased contractility, blood pressure goes up, can lead to arrhythmias if there's some underlying vulnerability, increased vascular resistance, more blood pressure, endothelial dysfunction, so vascular issues. And then the high release of cortisol has been shown to have negative effects on the central nervous system, including increasing risk of mood disorders and mental health disorders, causing GI ulcers, weakening the immune system, as you will see, producing more inflammation. I'll show you the pathways, leading to fatigue, lethargy, decreased physical and mental performance, causes muscle catabolism and bone catabolism towards osteoporosis. It counters the effects of insulin, so blood sugar can rise, increases the breakdown of glucose from the liver, so blood sugar is higher for two reasons. You're resisting insulin and you're causing more blood sugar to be broken down from the liver. So this hypercortisolism is contributing to a lot of the stress-related diseases that we see. So you see the negative effects of cortisol played out here, including interfering with thyroid hormone to some degree. A lot of people have normal thyroid blood levels, but they have hypothyroid conditions because cortisol is combating the effects of thyroid on the target tissue. So in 2017, there was a great review of stress on the human body that sort of goes into detail to show structurally and physiologically what happens. But stress causes structural changes to different parts of the brain, leading to brain atrophy and decreased weight. So the brain is shrinking, decreased memory capability, a reduction in dendritic branches and synaptic terminals. We've known for a long time that cortisol has a negative effect on memory. We've seen that in a lot of studies, including experimental studies. It also has a negative effect on mood and cognition, pushing things towards behavioral, cognitive, and mood disorders. Someone who's prone to depression, high cortisol levels, and high stress is likely to push it over the edge and to prevent some of even the antidepressant drugs from working effectively. So stress increases interleukin-6 and high cortisol levels, often seen in people with depression and other mood disorders and cognitive problems. So chronic stress has been shown to cause cognitive disorders, especially in memory and judgment, because it's often affecting the hippocampus and the prefrontal cortex. People start making bad decisions when they're under stress. It weakens the immune system by inhibiting many important white blood cells. It's linked to an increased risk of malignancies because a lot of the immune cells that are required for immune surveillance of emerging cancer cells can't work properly. So tumors get a chance to start growing. And so it also, even norepinephrine release also tends to suppress the immune system function if it's prolonged over a period of time. Stress and cardiovascular disease is not a surprise. It is linked to increased risk of cardiovascular disease, increased heart rate, contractility, vasoconstriction, narrowing of blood vessels, high sodium and levels causing more water retention in the bloodstream, so you have higher blood volume. But it's also increasing thrombosis and platelet stickiness. These are the things that lead to heart attack and stroke. It increases blood pressure and blood clotting and vascular changes, all these things increasing atherogenesis and atherosclerosis, everything that you just know is not going to be good for the vascular system, likely increasing risk of myocardial infarction, decreasing microcirculation to the coronary arteries. In the gastrointestinal tract, it affects everything. Absorption of nutrients, intestinal permeability, mucus secretions that line the gut. If they're decreased, you're going to end up with more peptic ulcers because acidity is going to sort of eat away through the intestinal lining, and also promoting GI inflammation. So it's been shown to aggravate, possibly trigger things like Crohn's disease and ulcerative colitis. Animal studies show it increases inflammation in the GI tract. Also aggravates irritable bowel syndrome, probably, I would think, diverticulitis as well, even though it's not listed here. So they conclude that, if the effect on the GI tract is so profound, it's affecting so many aspects, that a lot of these GI conditions that people develop, there's this undercurrent of stress that's sort of behind the curtain that's also helping to drive it over and above genetic risk factors and other contributing aspects. So what we see from these studies that are published is that adaptogens have the ability to help the body enhance their resistance to all kinds of different types of stress, providing a neuroprotective effect, anti-fatigue, antidepressant, decreasing anxiety in some people. We'll look at some of these studies, improving the central nervous systems and the brain's ability to process information, to be more alert, make better decisions, and also to increase mental work capacity when people are under stress, and physical work capacity when people are moving towards sort of physical exhaustion from the activity that they do. So what we're going to drill down on here is what happens on a molecular level, because this is all new. What I've said up till now makes a lot of sense to you. The question is, how is all of this happening? How is stress actually affecting these systems? And what exactly are adaptogen herbs doing on a cellular, molecular level? And that's what I want to share with you now, because you're going to start to see how it upregulates heat shock protein 70, how it downregulates the FOXO factor, how it upregulates upregulates the FOXO transcription factor, downregulates which known as the JNK stress activated protein kinase system, and alters how the cells function, including brain cells. And understanding also that stress also increases reactive oxygen species, more free radicals that make cells, push them towards programmed cell death, apoptosis. So you have fewer functional cells in your brain, in your pancreas, in your kidneys, and elsewhere. It also pushes cells into senescence, where the cell is there, but it's not really functioning properly. In fact, it's secreting cytokines that can actually damage the organ that it's in. And that reactive oxygen species also inhibits the cell's ability to make the ATP energy it needs in order to function properly. So adaptogen herbs are able to help to mitigate all of this, as I'm going to show you. So to understand this, in aging cells and cells that are under stress, as you will see, they decrease their expression of heat shock protein 70 and its precursor. So there's a transcription factor called HSF1 that turns on the gene that produces heat shock protein 70. So in aging cells, as we get older, we have less of these. And the decrease in heat shock protein 70 inhibits our ability to cope with stress and moves the cell towards programmed cell death and senescence and more free radical damage, less ATP production. So adaptogen herbs increase the expression of the heat shock protein transcription factor, increasing the secretion of heat shock protein 70, which protects us By stopping these events that lead to programmed cell death and switches the cells away from apoptosis into better survival and longevity mode and higher functioning. And so we see that a decrease in heat shock protein is linked to Alzheimer's disease and more beta amyloid plaque, decreased detoxification ability by the liver. When you decrease heat shock protein 70, it also turns on the production of something even worse, and that is more stress activated protein kinase, or JNK, that actually encourages cells to die and to go into apoptosis. And it also triggers more free radical damage and more inflammation, as you'll see. So by increasing your heat shock protein 70 and decreasing the JNK stress activated kinase switch, that helps the cells adapt. One of the things that you see in centenarians, people who live to be 100 years and older, they tend to have higher heat shock protein 70 in their cells. So genetically, maybe they were given this gift where they just naturally maintain higher amounts over the lifetime. And it acts as an epigenetic switch to, like the sirtuin longevity circuit, to help the cells survive for longer periods of time. So in young people, the balance is in favor of more heat shock protein 70 and less of the JNK stress activated kinase. But as you get older, the balance shifts and you have less of the heat shock protein 70 to protect you, and you have higher amounts of the JNK pathway, which is not going to be helpful. So in the onset of many degenerative diseases and age-related illnesses, you often see that these two pathways are at the center of it. You see a rising JNK and a depletion of heat shock protein 70. And you see the same thing in stress. So a picture is, worth 1,000 words. So this really explains it better. So with aging and with more oxidative stress, which we see when there's persons under chronic stress, is that the JNK pathway is turned on, the stress-activated protein kinase, JNK, and then it speaks directly to the p53 tumor suppressor gene. And it tells the p53 tumor suppressor gene to actually tell the cell to die, apoptosis, or to go into senescence, where it's alive, but it's not functioning normally. In fact, it's secreting inflammatory cytokines. And if there's any initiated cancer cells close by, it'll cause those cancer cells to start growing. And it speeds up the aging process. Whereas when you're younger, you have higher amounts of the transcription factor to increase the synthesis of heat shock protein, which has tremendous anti-aging effects. And heat shock protein also blocks JNK and tells the p53 tumor suppressor gene not to cause cells to die, not to go into senescence, not to speed up aging, but to have the opposite effect. It turns on the p53 genes to repair the damage. That's critically important. So not only is being young part of this, but adaptogen herbs do the same thing. They upregulate the transcription factor, increasing more heat shock protein 70, and they have an anti-aging effect, and they block all of these events that lead to cell death, brain atrophy, all these decreased dendritic synapse, all of that is blocked with adaptogen herbs. That's what's exciting. So the adaptogens like rhodiola, schisandra, Siberian ginseng, other ginsengs as well, and we will see also studies on ashwagandha, have been shown to upregulate the transcription factor that increases heat shock protein 70 in vivo and in vitro. And the adaptogens also inhibit the JNK pathway that normally would lead to apoptosis and aging. Now, the other thing is that adaptogens also increase the translocation to the nucleus of what's known as the FOXO transcription factor. So FOXO goes to the nucleus, as we will see, and turns on different genes that help the cells make their own antioxidant defenses, like glutathione, superoxide dismutase, and other endogenous antioxidant enzymes that protect the cell from free radical damage And when you do that, the cell can now make more ATP energy, as you're going to see. So when you have the FOXO gene turned on as adaptogens do, it's linked to adapting to stress, better longevity, cell survival, better cognitive function in brain cells, and it increases the endogenous synthesis of antioxidants. So let's look at that. So in this diagram, the adaptogen herbs come in and they upregulate the transcription factor, HSF1, to make more of the heat shock protein family chaperone molecules, which also help to improve immune system function, right, to counter the effects of stress. Upregulates the FOXO expression that we talked about, that does all kinds of things linked to survival, longevity, higher cognitive function, more antioxidant protection. But it also increases the synthesis of what's known as the neuropeptide NPY, which then in the brain has antidepressive effects, decreases the feelings of anxiety, improves energy balance, and helps to regulate the hypothalamus pituitary axis so you don't oversecrete cortisol. This is unbelievable stuff. A few more ugly details. We think that short-term and mild stress is sort of a normal thing, but when stress becomes really severe and prolonged, you get this increased the reactive oxygen species, more free radicals, including nitric oxide, which is known to inhibit ATP production. And then the JNK transcription factors, not only do they have all those negative effects we talked about programmed cell death and senescence and aging, but it also blocks the glucocorticoid receptor. So when you do that, normally when cortisol levels get high, the hypothalamus says, okay, we've got enough cortisol. I'm not going to keep secreting corticotropin. But because this pathway also blocks that receptor, you keep getting higher and higher amounts of cortisol released into the bloodstream, leading to fatigue, depression, impaired memory, decreased ability to concentrate as the stressful condition continues. So adaptogen herbs normalize stress-induced elevated levels of cortisol and other extracellular and intercellular mediators of stress, such as nitric oxide and the JNK system, also known as the stress-activated protein kinase. It also upregulates neuropeptide heat shock proteins, and it's known to inhibit that stress-activated protein kinase, which normally causes apoptosis, inflammation, and cell death. Consequently, nitric oxide levels are reduced, ATP production is increased. So the heat shock protein functions intracellularly to enhance anti-apoptotic mechanisms so the cell doesn't die. It helps to protect the proteins from being folded in an abnormal way that would lead to apoptosis. It decreases free radicals and decreases nitric oxide, increasing superoxide and decreasing reactive oxygen species like the superoxide anion. So it also stimulates it has immune stimulation effects, and both neuropeptide and the heat shock protein are directly involved in cellular adaptation to stress, increase survival, enhance longevity, improve cognitive function. This is remarkable stuff. So it just has all these great benefits. So this is I came across this research paper that sort of summarized this so well. So it shows that the effects of cortisol being so negative, but here's the adaptogen herb rhodiola turning on the transcription factor to increase heat shock protein. It then blocks the JNK pathway, so it stops the release of nitric oxide and free radicals, and so you get more ATP production. And the neuropeptide also has positive effects on the neurons in the brain. And we also have the blocking of excess cortisol release and the upregulation of FOXO transcription factor that leads to better adaptation and survival and all of these things. So we're understanding now what we didn't understand in previous years, exactly how these adaptogen herbs are working at the cellular level. I'm sure we're going to understand more of it in the future, but what it says to me is that for all kinds of different conditions, that part of the missing link in the management of mental health disorders, physical health disorders, chronic degenerative diseases, part of the missing link is to also provide adaptogen herbs as a secondary level of support to help the body adapt to stress and normalize its homeostasis so the other interventions can be more successful. So if you want to understand all the legends, that all these short forms that you see here, I've sort of given them to you on this page. And then finally, just showing you the importance of the FOXO transcription factor. The FOXO transcription factor is actually called the fork head box transcription factor. These crazy names. But so adaptogen herbs upregulate FOXO, which has this direct effect on longevity and survival, which I'll show you. But it also upregulates the body's synthesis of antioxidants like the superoxide dismutase and catalase to protect itself against free radicals so you can make more energy. And of course, the adaptogen herbs are making a heat shock protein 70, blocking oxidative stress and stimulating immune system function. All the things that we talked about summarized very nicely in this research review. So in 2020, in medical research reviews, looking at the studies on adaptogens, they say, listen, we've taken these adaptogen herbs and we've applied it to different organisms like fruit flies and earthworms and the Saccharomyces yeast. And whenever they look at longevity studies of anything from resveratrol to metformin to rapamycin, the first studies they do are on fruit flies, earthworms, and yeast. And they said, listen, when we give these different organisms, these rhodiola and schisandra and other adaptogen herbs, it significantly decreases the stress-induced elevation of JNK, even in rabbits, but it prolongs lifespan in these species, which is, pretty impressive. They say they also decrease the conversion of HDL into LDL cholesterol, which may have important effects on preventing cardiovascular disease. And in cancer research, they're saying, the adaptogens downregulate the more dangerous estrogen receptor, which is the alpha estrogen receptor, which is often overexpressed in breast cancer and ovarian cancer, colon cancer, prostate cancer, and endometrial cancer. And in terms of neurodegeneration, it upregulates the estrogen receptor in glial cells, which is linked to better cognitive function and decreased brain inflammation. So this is sort of experimental studies now. In terms of articular cartilage damage, it's been shown to help block the oversecretion of reactive oxygen species and to decrease the translocation of nuclear factor kappa beta to the nucleus. Remember that in inflammatory conditions that affect the joints, that it's nuclear, one of the main things over and above prostaglandins is that nuclear factor kappa beta goes to the nucleus and upregulates these genes that code for inflammatory cytokines to be released. So especially in autoimmune diseases, you see this, where nuclear factor kappa beta is a major driving force. Adaptogen herbs, at least experimentally, have been shown to block that. And in some early studies with patients with rheumatoid arthritis, we see that they have responded well to the use of adaptogen herbs. So adaptogens downregulate nuclear factor kappa beta's translocation to the nucleus, helping to decrease inflammation. It also helps to block other transcription factors related not only to inflammation, but also to faster cell division that is linked to cancer. So one of the main ones is known as the AP1 transcription factor, which is involved in many cancers. We see this one is overexpressed in many types of cancer. What I'm saying is that adaptogen herbs are able to downregulate the AP1 transcription factor. This may be one of the ways it may help to defend even against cancer and hyperproliferation, because hyperproliferation is the cells divide faster. Remember, your telomeres are shortening. You're getting to a point where cells are either going to become cancerous or go into senescence. So you're slowing down the rate of cell division. This is always helpful in the prevention of disease and aging. So I've given you some research there from 2021 from the BMC Experimental Hematology and Oncology Journal. So you can read that at your leisure. Also showing that adaptogens switch on the FOXO gene that helps cells decrease oxidative stress. turns on the NRF2 signaling transcription factor, which actually influences 600 genes that are related to survival and antioxidant protection. I mean, it's great. If you can upregulate these genes, you have a better chance of survival. And these adaptogen herbs do that. In terms of respiratory infections, the efficacy of adaptogens in the treatment of acute respiratory tract disease is possibly also partially associated with downregulation of pro-inflammatory nuclear factor kappa beta signaling. That means I'm going to show you a couple of studies where people who are coming back from respiratory tract infections often respond faster to treatment if they're given adaptogen herbs, likely because it's downregulating the cytokine storm type reactions that you see when infections are quite extensive. To say in conclusion, adaptogens, the observed beneficial effects of adaptogens in aging-related disorders include neurodegeneration, atherosclerosis, and impaired apoptosis. This is just a nice little summary of things that are affected by stress and how so many of the physical and psychological and energy complaints that your patients talk to you about as you go treating them with good care and lifestyle advice, it's sometimes the next layer of intervention is to get them adaptogen herbs to help their body get back into a better state of homeostasis. So there are some clinical studies with adaptogen herbs, which I want to show you right now. Looking at ginseng and rhodiola and schisandra in pneumonia has had a positive impact on patient recovery by decreasing the duration of the acute phase of the illness, increasing patient mental performance during the rehabilitation period, and improving patient quality of life. The quality of life scores increase when adaptogen herbs are given as part of the treatment. It's not the whole treatment, it's part of the treatment for recovery. Also, adaptogen herbs have been used in the adjunctive management of cancer because it makes cancer treatments work more effectively, decreases many of the side effects of radiation and chemotherapy drugs, and also helps to reduce cancer-related fatigue. This is important stuff. And there's a lot of experimental studies in the cancer realm looking at different adaptogen herbs. This is rhodiola showing that when you apply it to human bladder cancer cells and different types of human breast cancer cells, that it has effects that would help to make chemotherapy drugs work better, even gastric cancer. So here's some references on that. There's other experimental cancer research with adaptogens published in 2018. Showing that adaptogen herbs help to activate immune cells so they can fight cancer better, help to suppress tumor growth, do all the things that you want it to do. There's 7 ways that it can help cancer patients in their view, and so I've listed them all here. You know, I can't get into them all in detail. Our time is too short today. I want to move to some of the other clinical studies. So there are some other human clinical studies with patients with rheumatoid arthritis where different adaptogen herbs have been shown to be helpful and reducing inflammation and pain. So as an adjunct to that, also as a sleep aid, there's studies to show with humans that it's been helpful to help people get a better night's sleep, get better quality of sleep. Also, women that have premenstrual syndrome in 2017, a great article showing that it can be helpful in certain cases where women with premenstrual syndrome, they don't respond to the first level of treatment, whether it's hormone replacement therapy or using something like a Divas Women's hormonal support, because what's happening is that when the body's under stress and it's making higher and higher amounts of cortisol, it's taking the available cholesterol that reaches the adrenal glands and it's converting it into progesterone and then it's using it for cortisol purposes. So to make more testosterone and to make more estrone and estradiol, these things become out of balance because cortisol levels so high. The body's using all the precursor material to make cortisol, and you're robbing the body's ability to make these other reproductive hormones that help to create normal menstrual cycles and normal libido and all these things. So what she said in this review is that, you know, I give my patients adaptogen herbs often if they don't respond to help decrease cortisol synthesis. As you'll see, that's exactly what adaptogens do in human studies. And so now more of the cholesterol is available to be converted into testosterone, estrogen, progesterone, and so on. So now what really has become highly impressive in the Western world, I think there's no way now to argue with this, is that they've now started to apply adaptogen herbs in the treatment of mental health disorders. And there's some great human clinical studies published in psychiatric journals that I'd like you to be aware of. So just in terms of some experimental studies that are important to get started with, in 2016, this great report showing that, although no direct mechanism has been described to link stress, cortisol, and depression, these findings are consistent with the notion that the adrenal glands secrete cortisol in response to a variety of stressors, which leads to deleterious effects on the brain that leaves the brain susceptible to depression. We've known for a long time that cortisol is neurotoxic. So it can disrupt neurotransmitter function and, lead to onset of depression. So now let's look at some real studies. So in 2017, the Georgia State Honors College Undergraduate Research Journal, so in North America, human clinical studies on mental health. They took ashwagandha and they said, we've known for a long time it has these great adaptogen properties. So we did a study. We did a prospective randomized double-blind placebo-controlled study examining the safety and efficacy of ashwagandha in reducing stress and anxiety in 64 adults with a history of chronic stress. So they give them this dosage of ashwagandha, and the results show that ashwagandha extract significantly decreased feelings of stress, depression, anxiety, and significantly increased general well-being after 60 days based on 3 different extensively used sets of stress scales. So there's standardized stress scales that are used in drug trials. They use the same ones and they showed a significant reduction in the treatment group. They also saw a decrease in serum levels of cortisol by day 60. So you're actually seeing the net effect of all those pathways I'm showing you, decreasing blood levels of cortisol. No, it was very safe. Same number of adverse events in both placebo and the treatment group. The dose they used was ashwagandha extract, 600 milligrams, standardized to 5% with analytes, which is, we think, the active constituent in ashwagandha. Here's another study on people who are under stress and they're overweight. So they do a double-blind, randomized, placebo-controlled trial evaluating the safety and efficacy of a standardized grade of ashwagandha on body weight management in 52 adults experienced chronic stress. The results, the ashwagandha root was effective in decreasing various psychological and physical symptoms of chronic stress, and it helped people lose weight and reduce their body mass index. The perceived stress scores went down significantly. There were serum reductions in cortisol that were significant between the treatment group and the placebo group. And it had no adverse effects on blood pressure, respiration rate, pulse rate, all that stuff. Then they did a study using ashwagandha on patients with anxiety. So they took 39 patients who had been officially diagnosed with anxiety disorder. This is a non-specific anxiety. 500 milligrams of ashwagandha was the treatment. At 6 weeks, about 33% more patients had a reduction in feelings of anxiety as they reevaluated them than in the placebo group. The herb was well tolerated. Then ashwagandha stress and anxiety study in 2012. Randomized control study enrolled 64 subjects with a history of chronic stress. They measured serum cortisol, assessing the response on standard stress assessment questionnaires. They gave them 300 milligrams of ashwagandha root extract, standardized to 5% with analyte. The study assessed the level of stress, depression, anxiety, and general well-being of an individual using 3 different extensively used sets of stress scales and looked at serum cortisol. Here's what they showed. After 60 days compared to the placebo group, the ashwagandha group showed a marked improvement in feelings of anxiety. They slept better, less depression, less social dysfunction, and a marked reduction in cortisol levels. Like really a 20% reduction compared to the placebo group in getting cortisol levels down. Critically important. What about burnout fatigue? Well, here's where we start to see rhodiola studies. patients experiencing burnout syndrome. Listen, I will tell you something that the work that I do today, I'm very much involved with the group benefit health plans of employees who work for large companies across Canada. That's where a lot of my attention is focused today. I will tell you that 35% of all disabilities from work are due to mental health problems. About 75% of the cost of managing disability from work is mental health problems. So employers, insurance companies, all the stakeholders, including the employees and the patients themselves, are looking for better ways to prevent mental health problems and get people back to work and to keep them at work once they get there. What we're seeing is that one of the missing links in the management is actually the application of adaptogen herbs, because you see the response that a lot of people have. So in this study, burnout, fatigue, that's why people are leaving the workplace and they can't cope anymore, because they're stressed. They have money problems. They have conflict with their, it's a stressful environment in the corporate world. So in this study, 60 individuals examined the effects of 3% Roosevelt standardized extract of rhodiola, a great adaptogen herb, gave them 576 milligrams a day. And the results were their morning cortisol levels were significantly reduced after 28 days. Then here's a stress-induced fatigue study with rhodiola in the year 2000. Double-blind placebo-controlled study, 100 milligrams of rhodiola extract on stress-induced fatigue, and 40 students during examination, the exam period. Remember when you were writing exams, how stressed out you were, board exams, all that stuff. Had we known this, we would have taken some adaptogen herbs. So they measured these students just prior to the exams. They looked at different physical fitness parameters. They looked at their sort of neuromotoric tests, where they, like a spiral maze test, at fine motor skills, tapping tests. They looked at mental fatigue capabilities, and they showed that the group that got the rhodiola, the study displayed statistical significance, improved physical fitness, improved less mental fatigue, and they had more of these sort of neuromotor tests, if I can't even pronounce the word. And also their general well-being was much better. So they were able to cope better with examination stress. And then they looked at mental fatigue in physicians with rhodiola. They said, well, you're going to see on the next slide, they're saying, listen, these night shifts and these long graveyard shifts that these physicians work sometimes in emergency is very stressful and causes cognitive fatigue and less concentration ability, wears them out. They said, let's give these people rhodiola. So they did a double-blind crossover study, repeated low-dose administration of standardized extract of rhodiola. The study presented statistically significant improvement in 5 mental fatigue and cognitive tests taken by 56 Armenian physicians. A group comparison change of 20% was what they saw. So the group getting the rhodiola showed a 20% improvement in all of the different parameters. They said the anti-fatigue effects were noted without any reported adverse side effects in a situation where they were constantly under moderate levels of stress-related fatigue. They had some great concluding remarks here. They said the physical and psychological symptoms of chronic stress can negatively affect aspects of an individual's life. Along with elevated cortisol levels, stress-related fatigue, burnout syndrome, irritability, weight gain, poor concentration, chronic stress has also been associated with various chronic diseases. Adaptogens help the body adjust to and positively respond to stress by normalizing cortisol, decreasing fatigue, and improving cognition. That's what if I'm going to go to the emergency room, that's the physician I want to be seeing me, who can think properly, his cortisol levels are normal, and he's not totally exhausted and ready to fall asleep. Adaptogens contain other beneficial properties such as antioxidant, cardioprotective, immune, analgesic, and energy properties. Therefore, ashwagandha, rhodiola, Bacopa monnieri, which we have in our memory support product, consumed at standardized doses may be beneficial for individuals suffering from physical and psychological symptoms of chronic stress, because sometimes just yoga and deep breathing exercises and exercise alone don't do it. And they also said, and I like this, Combining adaptogen herbs may potentially be more beneficial than using them individually. And I believe that when you combine them, they have synergistic effects. And also combine them with vitamins and minerals, antioxidants. This is probably the right way to go. Here's another study in 2017 in the Journal of Neuropsychiatric Disease and Treatment, rhodiola and burnout. This study is unbelievable. 118 male and female outpatients. So they were already in the hospital. Now they've been released. Age 30 to 60 years of age who were suffering from burnout symptoms. These are the patients I was talking to you about earlier. They leave the workplace, they're hospitalized, now they come out. And what they're stressed out about is something that's not just going to go away. They're caring for a person at home who's handicapped or a demented family member that has, say, Alzheimer's disease, and they're the primary caregiver. So these patients ingested 400 milligrams of standardized grade of rhodiola extract daily over a 12-week period. Right? The results showed the subjective stress symptoms underwent significant improvement, which suggests an increase in coping ability and a decrease in subjectively perceived demand after the intervention. So their perceived level of stress goes down. A significant percentage of the patients reported improvements in the following specific parameters. Now they feel more joyful. They have more of a zest for life, improved alertness. They're accomplishing more in their personal life and professional life. And now they have an interest in sex again. Once interest in sex comes back, the person's probably on the road to recovery. Some of the patients experienced improvement in just the first week of treatment with rhodiola, and the majority of patients saw an improvement by 12 weeks. The researchers noted that other trials evaluating the effects of rhodiola extract improving the physical and mental performance under stressful conditions confirm and support these findings. In other words, we've seen other clinical trials and got the same result. Here's some other research. Here's the Journal of Pharmaceuticals in 2010. Here's what they said. Rhodiola also acts like an antidepressant drug, slowing down the breakdown of dopamine and serotonin and norepinephrine. That's what Prozac does. It slows down the breakdown. And that these herbs can be used as an add-on to these drugs to help them work better. And it also decreases their side effects, and it helps to address the other part of depression and burnout and fatigue. And that is, in the Eastern European countries, they have a condition called asthenia syndrome. That's where the person is like, they're weak and they have reduced work capacity. Their memory's not so good. They're irritable. They have headaches. They have insomnia. Their appetites. You've seen this patient. They can't figure out what they have. They have all these symptoms where they just don't have energy anymore. They can't concentrate. They want to sleep all the time. They have poor appetite. They give them antidepressants. It doesn't quite work. This asthenia syndrome is often helped very much by the introduction of adaptogen herbs. And we know that giving rhodiola to people who are under physical and mental stress, heavy workloads, helps them adapt better. So they're saying, now what they're saying is that if you know that you have a major mental stressor coming up where you have to write exams or stay longer in your office, or you're facing some major stressful event, take the adaptogen herbs in advance. Same with if you're going to run a marathon, or you've got an intensive work schedule, travel schedule, taking adaptogen herbs in advance and often during the stressful event may help to mitigate the effects of stress on the body. And that's basically what this is saying. Also, faster recovery from infection, as I alluded to earlier, downregulating nuclear factor kappa beta. Patients suffering from post-influenza fatigue. So they recover from the influenza, but they just don't have their energy back, and they can't think, and their brain is foggy. Right, giving them rhodiola extract has helped them improve focus and attention, and the headaches disappear so they can concentrate again. So decreasing these effects of asthenia seems to be very important, and also helping to eliminate the sort of depression that goes along with that low energy state. One of the first trials on rhodiola and depression was done back in 1983. It was an open trial where rhodiola extract was given for 1 to 4 months in 58 patients with stress-induced depression. It showed a remarkable symptomatic improvement. Their general weakness or feeling of being worn out in the morning with high fatigability and hypersomnia during the day disappeared or was considerably reduced. You've seen patients like this all the time. I can't get up in the morning. I can't face another day. I don't have the energy. I can't think. I've got a headache. How many times have you seen that? Using rhodiola in conjunction with antidepressant drugs helps them work better, decreases the side effects. There's evidence for it. Also, decreasing the side of patients that have schizophrenia, right, who are on these anti-schizophrenic drugs or psychotherapy drugs. They all have really bad side effects, where the person gets tardive dyskinesia, or they get weird physical movements, Parkinsonian type movements. 31 patients with all these types of symptoms given rhodiola, it helped to decrease the symptoms in the person given the psychotropic drugs. Studies on Schisandra, another great adaptogen herb, right? Psychiatric patients can be used in psychiatric practice as a symptomatic agent against asthenia, depressive states. Those people who have depression and they don't have energy and they have low-grade headaches and they can't function. They've got blurred, foggy brain function. Also to decrease fatigue and improve general mood and appetite. It's been shown to be useful in human studies. In the treatment of psychosis as a stimulant without harmful effect, as an adjunct to the schizophrenic drugs that are used, you can add it on to help them work better. To help decrease depressive syndrome with conventional treatment. The combination of Schisandra therapy with tranquilizers or antidepressants eliminates the side effects of these drugs and allows them to be employed at optimal doses. So they can use more optimal doses of drugs in the presence of some of these adaptogens because they help to decrease the side effects. So in 2010, in the Journal of Pharmaceuticals, they made this concluding statement. They said it was suggested that adaptogens have not only specific therapeutic effects in some stress-induced and stress-related disorders, but will also help an impact on the quality of life of patients when implemented as adjuvants in the standard therapy of many chronic diseases and pathological conditions like post-surgery recovery, asthenia, congestive heart failure, chronic obstructive pulmonary disease. It may be suggested that adaptogens have potential use in age-related disorders such as neurodegenerative diseases and cardiovascular diseases. Thus, elderly people, as a whole separate group, may be able to maintain their health status on a normal level, improve their quality of life, and may increase their longevity. However, further research is required, as it is with everything else. So before we get too excited about adaptogen herbs, there are some that I think you have to use with caution, or I would avoid altogether. As great as ginseng is, whether it's Panax ginseng, Korean ginseng, Siberian ginseng, they all have ginsenosides. And those ginsenoside active constituents speed up liver detoxification enzymes. So it speeds up the detoxification of a whole bunch of drugs like anticoagulants, blood pressure drugs, diabetic drugs, antihypertensive drugs. So it messes them up. So I'm very reluctant to use it. Plus, it has a stimulation effect like the central nervous system. So it potentiates the effects of caffeine and other stimulants, can cause rapid heart rate. It may cancel out the effects of pain-killing drugs that patients are using because it speeds up their detoxification. High doses of standardized grades of ginseng have led to ginseng abuse disorder with all these crazy symptoms. So I tend not to prescribe ginseng. It's a great adaptogen herb, and I know it's great, but I tend to not recommend it. Same with licorice root, which I never recommend because it contains glycyrrhetinic acid. It's a great adaptogen herb, but it raises blood pressure and it slows down the detoxification of all kinds of drugs, leading to digoxin toxicity, warfarin, changing the INR or the prothrombin time, changing the detoxification of everything from caffeine to acetaminophen to other even muscle relaxants. There have been many human reported cases of adverse events in people using licorice extract supplements, and you see all the symptomatology here. So I don't use licorice, although it has adaptogen properties. I don't like it. A number of years ago, I created this for Adiva Nutritionals. It contains the standardized grade of rhodiola, ashwagandha, and schisandra. These are three really safe herbs where there are no major drug nutrient interactions, along with nutrients that helps to support the synthesis of hormones, in the adrenal glands themselves, like including cortisol and aldosterone. This has been a fabulous little product. Other Adiva products contain some adaptogen herbs and immunodetox prime. We have reishi mushroom extract and sleepy naturals. We have Boca Monieri. It's also in our memory support complex. But the adaptogen herbs, using something like Adiva adrenal support complex, who are the patients that are likely to benefit? These people with general unexplained fatigue, people, athletes who are overtraining, people recovering from infections, people with known weakened immunity, people trying to prevent or as an adjunct to mental health conditions, people with decreased libido, menopausal women who are not responding to standard treatments. You can add this on. Same with people with underactive thyroid conditions, people with sleep disturbances not responding to melatonin and Adiva sleepy naturals, people with decreased concentration abilities, people with having to undergo physical endurance on a regular basis, people with early stage memory loss, stress-related hair loss, people not responding to exercise and diet and weight management programs, people with early stage neurodegenerative conditions, possibly using it as a preventative to prevent steps in carcinogenesis, and people with autoimmune conditions. All these people, as part of the adjunctive therapy, I would consider adding this. I've used it with myself and with other patients, and most of them are very happy. It adds another layer of improving their general well-being. So you might just want to try it yourself. But the overall management of stress, let's be honest, endurance exercise is very helpful. Using mind-body techniques, progressive relaxation, meditation, deep breathing, yoga, these things are all great. Also being careful with stimulants, but to decrease the oversecretion of cortisol and to get these other benefits of upregulating FOXO, upregulating heat shock protein 70, decreasing the JNK pathway, this is where, the adaptogen herbs really start to be sensational. And I put all the three safest, most effective ones together at the right dosage and standardized grade in a Adiva adrenal support formula because it's what I wanted for myself. So thank you very much for sitting in today. Our time is up. But I really do appreciate you being part of this. We will send you the slides. Thank you once again, and I hope you have a great week, and we'll be back with another webinar.